Hello, my name is Treva MacArthur. I am a long-term care home and community manager with Simply Healthcare. I am also a certified person-centered thinking trainer. Today's podcast will focus on person-centered planning in an assisted living facility setting. ACA, which is the Agency for Healthcare Administration, requires health plans like Simply and providers alike who support and manages recipients of Medicaid services to incorporate a skill called person-centered planning in the lives of members. Person-centered planning is a customized plan that specifically fits the need of an individual, much like a fingerprint. No one plan is alike if done right. Person-centered plan outlines what's important to and what's important for the resident. At the end of the plan, it will show how the resident chooses to live.
Who creates the person-centered planning?
Plans are created in partnership with the resident, family, power of attorney, guardian, or whoever the resident will like in their planning. In addition to those individuals, the plan must also include support staff and those who are providing care. Long-term care, LTC, members residing in an assisted living facility have a person-centered care plan in place, which was developed with the member and family, along with their long-term care case manager. These plans can be found in the residence chart at the assisted living facility. So as an ALF, you are an extension of what has already been created. Your role is to ensure that what we've already created or developed is fulfilled.
Can you tell us some ways how we can support person-centered planning in our ALF?
Absolutely. There are 5 ways I can share with you. Medication management is important for residents. It is important that their meds are managed as prescribed. So your role as an assisted living facility is to ensure that you are compliant in medication management. Number 2, meal planning. It may be important to a resident to have gluten-free meal options. So as an assisted living facility, your responsibility will be to offer customized meal planning for those especially with dietary restrictions. Number 3, safety. It is important for the member. Say, for example, her power of attorney, who is the daughter, it may be important to her to ensure that her mom, who has dementia and who has a history of elopement, is secure at all times. So therefore, it is the role of the assisted living facility to ensure that this member is in a secure area and monitored by staff to avoid elopement. Number 4, incontinence supplies. It is important to a resident to have appropriate product to maintain their hygiene and dignity. A resident with light leakage, for example, a female will require simply a liner. A male may require a male guard. A member who ambulates independently with moderate leakage will be best suited for a pull-up, not a diaper. Diapers are specifically created for those who are bedbound. But understanding that each assisted living facility contract may be different, you may not supply that. However, if you do, it is highly suggested if you're to incorporate or infuse person-centered that you have the correct product for that member based on their incontinence. Finally, number 5, community activities will be another great option. It's important. It may be important to a resident to attend a religious outing, go to a park, visit family, for example. Your role as an assisted living facility will be to assist the member in getting to their desired weekly activity. Note, Simply does provide transportation for social outings. As needs of individuals change from time to time, offer opportunities for residents to have person-centered planning meetings. This meeting should allow the resident to share information on what has changed, what new goals they may have, what again is important to, and also remembering what's important for. As long as the resident's health and risk health and safety is not at risk, developing a plan which incorporates their requests in these meetings are an essential part of infusing person-centered planning in an assisted living facility setting.
What are the benefits of person-centered planning?
There are a few. It has shown that it will increase resident satisfaction, residents feel respected, evidence of longevity, less hospitalizations, and fewer complaints to the plan as well as the agency.
How can we ensure we are providing a home-like setting that is person-centered?
We have a few ways. Residents have a choice to choose their roommate when possible. If available, residents can select their own room location. Residents should have a key to lock their door based on their cognitive ability, of course. They are able to have guests at any time. Evidence of equality among those who are private pay versus those who are Medicaid. Residents can freely decorate their space, listen to music, and even watch television. Residents have their own phone, but if they don't, have access to a landline to make private calls. In summary, as we close, a best practice will be for assisted living facility owners and administrators to create a questionnaire to support person-centered planning that is important to and for your resident. You want to involve a resident and their representative or their guardian, etc., in the decision making with these things for many reasons. They'll have a buy-in, it'll raise resident satisfaction, and it'll show that you are a person-centered facility. Thanks for tuning in. I hope you found this information helpful.